Okay, so good afternoon, everybody. So I'm glad for everybody who could join us live, and that I'm going to be talking about a topic today that people in my practice have been hearing about for about 2.5 to 3 years, ever since I discovered the Dale Bredesen recode method of protection and reversal of cognitive decline. And as many of you, I've had lots of conversations with lots of people. My program has kind of evolved over the course of time. And as I'm learning the delivery of the program a lot better and the big difference between prevention and reversal. So any of you watching this, you may hear some different things than you've heard in the past, but now I've really gotten down to where Dr. Vince and I are going to deliver the preventive component of what we're doing here. So I'm going to share my screen. So let's see, that's it's not advancing. Thank you very much. Bear with the technology here. There we are. All right, good. So we actually have a few people on there that are not patients of mine. So I'm glad I was going to plan on this anyway. But for those of you who are my patients, you've seen this map. Everybody, I believe, has seen this map where it is the whole structure of what we do at RHS in the preventive medicine program. Where if we want to be like those two people in this upper left here when we get old, and you can define old at the age of old, and don't want to be like the guy in the wheelchair, we have to have a strategy. We can't just hope that we're going to have a good old age. We need to have a strategy for making it there, because this is meant to be baby boomers, because we baby boomers think we look like that. But this is the path of health that leads to being these two. This is the path of disease that leads to being the guy in the wheelchair. And the big three I talk about that we aim to prevent are heart attacks and strokes, cancer, and dementia. And for years, I basically did heart attack and stroke prevention, hoping I was going to be protecting your memory. And to a point, we were. But now we have a plan, very much like the heart attack and stroke program that you all know, to address dementia, very specifically developed by Dr. Dale Bredesen. I'll talk a little bit more of that in a bit. So that's what we're talking about here. So now what we're focusing on is the prevention of dementia. So first, let me define a couple words for you. So reverse cognitive decline. So those who either attended or watched the presentation I did a couple of years ago was talking about RECODE when his first book was about reversing cognitive decline. That is a very big, very time-consuming program for people who have cognitive decline, and we need to reverse it. Very possible, but it's a full court press. And we're not talking about that today. What we're going to be talking about today is people who want to prevent cognitive decline, who are doing decent at this point, and we want to keep it that way until we're at an old age. And how and basically how I'm going to be, and Vince are going to be delivering it in our practice here. So just kind of a little understanding of cognitive decline. So basically these are the curves. It's normal to have your cognition diminish a little bit over the course of time. It might just diminish a little bit, so that the bottom part of the graph is aging, and starting at the top is great cognition when we're young and declining as we age. So there's three kind of levels of normal where you lose a little bit. This is like the old person who's sharp as a tack who loses almost nothing, or kind of a normal path of having cognition diminish a little bit. And then there's the path that none of us want to be on, where we start off with kind of this preclinical phase where we have subjective cognitive impairment, where we can feel things happening. It's not quite what it used to be, but it's not objectively abnormal on formal testing. And then there's this phase of mild cognitive impairment, which is getting into the abnormal range, where you're getting testing is showing a little bit of abnormalities, and then it diminishes into the mild, moderate, and severe Alzheimer's disease. So in terms of prevention, the earlier you begin, the better. all of our kids and grandkids, it's best to start when we're young or as soon as we possibly can, because we want to catch it back in this preclinical phase. Because Dr. Bredesen talks about the earlier we begin, the better. The best in reversal are those who are mild cognitive impairment and early Alzheimer's disease. And you'll hear later about the whole reversing cognitive decline. That's not what we're doing in our practice here, but we're going to be putting together something that I was trying to do a couple of years ago with, if you remember hearing something about a memory treatment center, that was meant for reversing things. And that's going to be coming for those who need it, or people who need it, but this is going to be for everybody and how we're working it into the practice. So just these are the books, and if you don't do anything else, I encourage people to read these books. Written Dr. Bredesen's first book, End of Alzheimer's, that was published in 2017. That talks a lot about the science behind why this all works. And then the most recent book that was published this summer in August was the End of Alzheimer's program. And this is where they, as a doctor and a business, he discussed it pre-code. He coined the term pre-code, which is preventing cognitive decline. And this talks more details about the program itself. So I'm going to give you a lot more options that are available for people who need it or want it. But at that book there talks a lot more about the process itself. So what do we do? So how do you know if you or someone you love are on the process of the next 5 to 10 years could be bringing up something significant? And that's the tough one, because you feel things happening, but are you going to be one of those normal declines, or are you on the path to Alzheimer's? So, so one of the things we've talked about genetics. And we've talked about the ApoE4 gene type. And most of you who are in my practice who have had your ApoE4, I haven't quite gone back and caught up on everybody yet, but now that we know that this is possible, I'm going back and checking everybody. But basically, ApoE4s are at higher risk for cognitive decline, double the risk of the average gene type or more. So I'm going to really encourage those who are ApoE4 or have a significant family history of dementia to to pay close attention and do some of these things that we're going to talk about now. So the reason I'm doing this now is that Dr. Bredesen, with his preventive cognitive decline, has offered out some other opportunities that I'm going to now show you how you can incorporate into your world and how that integrates with what we do here in the practice. So basically, the CNS vital signs is a formal cognitive assessment. So the gold standard is a 4-hour test that trained psychologists do called neuropsychometric testing. That gives you an idea of how is your cognition on a very deep level. Well, CNS vital signs is a very good proxy for that, where it gives you about 93% accuracy of that big, long, expensive test, but it gives it for you at it only takes 30 to 40 minutes. You do it in your own home on the computer, and then the computer spits out a detailed report. And it's really ideal for tracking. So where you can do it now, a year from now, you can do it again and can track it over time. And they've got graphs that they give us in our training on and actually the different gene types. It shows how people will deteriorate over the course of time. But it helps us to catch us at the early phase if things are starting to happen and get a good barometer of how you're doing now. So that's CNS vital signs. And I'm going to talk at the end on how you can kind of get incorporated into that. So you can do it once a year, more frequently if you need to, but it's for tracking. So the other thing is, through Dr. Bredesen's built a business called Apollo Health. It's an educational platform. And for a monthly subscription, you can subscribe to his preventing cognitive decline or his reversing cognitive decline. It's again, that's a very different approach from the clinical standpoint. So for anybody on this call, you're looking for the prevention component of it. So it's a monthly subscription. You get a pre-code report. So where it's a little bit of an analysis, but it's honestly not as nearly as in depth as we do with the wellness evaluations that I do, but it's a few basic labs that he plugs into a software or we plug in on your behalf, and it spits out an educational report. So I've seen the reports, and it's really great for education. I have to help you interpret the interpretation of your numbers, but for education, it's great and helps to sort out where your priorities are. If you go looking at doing this, don't pay for the labs, because we do the labs here. We can, and any couple extra that we need for this, we can include with your next wellness evaluation. But they offer a way that you can pay if you don't have a doctor you're working with, that you can pay for the labs yourself, but you don't need that if you're a patient here. And it includes a brain games a platform called Brain HQ. I'm going to talk about that next. So as part of the subscription to Apollo Health, you get with that the Brain HQ platform. So, oh, 1 second on that. So I'm going to try to explain and not confuse people. I can do that. But educational platforms. I mentioned last week, and you're going to hear more about it, a platform called Kaigo. Kaigo, and you're going to get more information about that. That is going to be my main engine for education moving forward. It's free signups. You can upgrade if you want to. You'll hear more about that, but that's how I'm going to deliver education, including some basic dementia education. That's going to be a platform where you get education beyond what I can do for you, but I'm going to be participating in the education with that. This here is an educational platform that doesn't involve me, and it's very dementia specific. It's better than Kaigo for dementia education. It doesn't even come close to Kaigo for general education for other topics that we'll get to. So that's just, I want to differentiate that so you don't get confused. What's Kaigo? What's Apollo Health? Again, this is specifically for people whose focus is on dementia prevention in your life. So Brain HQ, you've all heard of brain games, Sudoku, crossword puzzles, Luminosity is another one, lower level one. Brain HQ has got the best science. Without question, it's got the best science in terms of actually improving people's ability to memorize, cognition, and processing speed. So it's actually scientifically proven to improve your cognition and processing speed. And ideal is to do it about 20 minutes or more 3 times a week. You can do more if you want to, and it's brain games. So it basically improves cognition. 2 ways you can access this. It is included with the Apollo Health platform if you choose to go that route, and you're welcome to do that if you want to. It comes with it. Or if you decide you don't want to do cognitive Apollo Health, which is fine, you can actually get an individual subscription directly from the company itself. But again, that's brain games. So the CNS vital signs is the assessment. Apollo Health is education, and this is actually going to the gym for your brain and exercising your brain. And it's not easy. When I got to demo it, and it's not a lightweight one. It starts off easier and can get very challenging. So this is one that works well. And then the last one, so Dr. Bredesen, if you read his book, he talks about 30 supplements. And for people who need reversing cognitive decline, it's a very extensive nutrient support. It's basically bathing your brain in all the best nutrients that have been proven to be beneficial for cognitive support. But the average person doesn't need that. It's expensive and it's a lot of pills and powder for reversal. And this is a big difference. And he just, not long, I think it was over the summer or early or spring, that he made this supplement he developed called NeuroQ available, specifically intended for people who want to prevent. Think of it like Prevagen. I've had so many people ask me about Prevagen. I'm never sure what to say about it because I can't see anything on the website or the bottle that says anything other than proprietary blend of some chemicals made from jellyfish. So they've got a great marketing campaign. I have no idea how beneficial it is. NeuroQ is some of the best of for what's called BDNF, brain-derived neurotrophic factor. It's the kind of the motherboard of brain support and new nerve growth in your brain. And he's taken some of the best supplements that help out with inflammation and good brain growth, brain neuron growth. And he's packaged it into this one pill. So for those of you who know Fullscript through me, that's kind of the platform I do where I can give you a good discount and it's easy ordering like Amazon. Unfortunately, this is not at this point available on Fullscript. It's a pain in the neck for everybody to have it ordered online for you guys. So for the time being, that we have to kind of make this available for you out of the office, and we've gotten a supply and can get more. So those of you who end up wanting to do that, you would have to get that one through our office. But again, this is the supplement, and there's those of you who want the details: turmeric, ginkgo, phosphatidylserine, all supplements to help brain nerve growth. So how does it look here? So it's kind of 4 options you have here. So for the CNS vital signs, that the way we're going to work that is that you contact our office, we get you a link, and we send you a link, and you do it at your home. We get the results, and then we incorporate that into your wellness care. So at your next, obviously, if there's any surprises or concerns, we'll talk about it sooner. But the plan would be to incorporate it as part of your wellness evaluation and what we do with that for the CNS vital signs. And again, once a year, every other year, 6 months, whatever we decide to do, depending on the situation. So that's the CNS vital signs for assessment. The Apollo Health, this is all on them. There's just for the prevention components, $39.95 a month. Again, don't buy the labs, and you do that. And then basically our team uploads your numbers into the platform, and they spit out that pre-code report of education for you, specifically based on your numbers. And again, we utilize that report in what we do in kind of a loose way. The Brain HQ, if you don't choose to get it through Apollo Health, as part of the $39.95 subscription through them, you can get it right through their company. And it's and if you I had it on the other one, but it's Brain HQ on there. I should have put it on this slide. I apologize for that. But basically, it's a $14 a month subscription, or you get it for a year for $96 for doing, again, the brain games there. And then if you choose, you want to do the supplements, that with our discount is $45 a month for that, if you choose you want to do that. And again, for those who want to wait and talk about your next wellness evaluation, any of this is fine. And if you want to get started now, that's fine too. You just contact the office, and they'll get you started on the CNS vital signs and anything else that you want to do and answer questions. So that's the overview of everything there. And again, we've been talking about this for 2.5 years now specifically, and this is just some more opportunities available for those who want to kind of take that next level on making sure you stay where you are now, or even getting a little bit better. So I'm going to stop there and open it up to questions that anybody might have. So if you have any questions, just please unmute yourself and go ahead and ask a question.
I don't know if we can see the chat there, Chip, to see if anybody has anything in the chat.
Yeah, so I'm going to stop my share here. Vince is here next to me, if you heard a voice in the background. So let's see here. Great. So now I can see everybody up here. So if you want to have a question about anything, go ahead and unmute yourself there. And I don't see any chats. So okay. So no questions. If you come up with things later, you can obviously contact our office to ask questions. If you want to get started, you can. Oh, somebody was trying to talk. There's a chat in there that somebody was trying to talk.
Oh, okay.
Peter, okay, go ahead. Question. Thank you.
Yeah, to be sending out,
Go ahead, Peter, what you got?
be sending out a summary of what you presented, because I started to take notes, but not as quick as your voice.
Got it. Great point. Yes, I will make sure that we will summarize the highlights of what we talked about on there. And I actually might just actually send you guys the slides and slides of what I just did right there. So you can take a look at them in the context of what we just discussed. So would that be good enough, actually, Peter, if you were to be able to get the slides of what I just did?
Right.
Perfect. And what I'll do is I'll have, in some capacity, I'm gonna let Kirsten figure that one out, but she's my techie. Figure out how to get everybody the information that they want to have from that. Good, good. Thank you for asking that. Good. All right. So it's
I was going to just mention one thing. It's Kirsten. You
Yes.
might see me as Charles Whitney, but we're also going to be sending out last week's recording. I know we have not done that yet, but we're going to be doing that ASAP.
Yeah, so yeah, what we're Kirsten was on vacation last week, so what we're with these, we're recording them for live, and she's going to send them out for anybody who wants to see what last week's, where I was introducing Dr. Vince, anybody who might not have been on that, joining me here at the practice. So okay, and I know there's actually a couple dentists on here. I'm going to have a call out for the ones who are on here. There's actually Dr. Bredesen is offering out training for dental practices in what he does and getting certified just like from as the physicians can. So if you I think you guys know how to get hold of it. If you want to hear more about that, there's actually a webinar tonight about that, about the opportunity for dental practices if you're interested. So that's all I have. And so if you have any questions, just holler. Otherwise, if people want to get started, go right ahead. Otherwise, we'll talk about it at your next wellness. All right. Take care, everybody.